My name is Kamisha Harris. This is my head to toe assessments for Spring 2023. We'll begin by scanning the room. Okay. So we'll begin our assessment by inspecting the skin of the head and face, the neck, the posterior and anterior chest, the abdomen, the upper and lower extremities. The skin is warm, dry, and intact. No edema, no tinting with turgor, no bruising, no lesions, no scarring, no nevi. The skin is smooth to texture. Next, we'll go by inspecting the scalp. The hair is evenly distributed, coarse in texture, color is black. There's no tenders, no infestations, no indentations, no lacerations. And so we'll inspect the head. Is normal cephalic, is midline and symmetrical. We're going to inspect the temporal arteries one at a time. No tenderness noted. We'll assess the lymph nodes, preauricular, postauricular, tonsillar, occipital, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Then we'll assess the TMJ, no crepitus, no subluxation or tenderness noted. We'll assess for cranial nerve 5, which is the trigeminal nerve. So we're going to ask the patient to clench the jaws, okay? And then we'll assess the sensory nerve. So you'll close your eyes and you'll let me know when you feel the soft touch.
Feel it, feel it, feel it, feel it, feel it.
Okay. We'll assess for cranial nerve 7, which is the facial nerve, by asking the patient to smile, frown, raise your eyebrows, pucker your lips, puff out your jaw. Okay, we're going to assess the ears. They're normal in shape, size, and position. We're going to assess the pinnae and tragus on both sides. There's no tenderness noted. We're going to assess the auditory canal and inspect the tympanic membrane. Okay. Then we're going to go to the eyes, the eyebrows, and lashes. The hair is evenly distributed. The palpebral fissure is symmetrical and normal. We're going to inspect the eyes. The sclera is white, conjunctiva pink, no lesions, no drainage. So then we'll assess for ocular nerve 2, which is the optic nerve. So we're going to ask the patient to cover one eye. With the Snellen chart, we're going to ask the patient to read the lowest line.
LTFPH.
Okay, cover the other eye, read the lowest line.
LTFPH.
With both eyes uncovered, read the lowest line.
LTFPH.
Okay. So the optic nerves were assessed for gross visual acuity and peripheral and central vision. So let me know, focus on my fingers and let me know when you no longer see them.
I no longer see them.
Okay. Then we assess for cranial nerve 3, which is the oculomotor nerve. We're assessing for consensual and direct pupillary reaction to light and accommodation and convergence. Okay, you can stretch it. Okay. So I need you to focus on this for me. Just follow it. Okay, pupils are equal and reactive to light and accommodation. So then we'll assess cranial nerve 3, 4, and 6, which is the oculomotor, trochlear, and the abducens. So we're going to assess the 6 cardinal gazes. We'll ask the patient to follow the pen light. Okay? Then we'll assess for red reflex using the same eye that I'm testing on the patient. Red reflex noted along with other eye vessels. We'll do the other eye. Okay? Red reflex noted along with other eye vessels. Now we'll go to the nose. The nose is symmetrical, intact. We're going to assess for cranial nerve 1, which is the olfactory nerve. We're going to ask the patient to occlude one nostril. And we're assessing for patency and smell. So close your eyes. Tell me what you smell.
Lemon.
Okay. So we're going to ask the patient to occlude the other nostril. And tell me what you smell.
Berries.
Okay. So now we'll palpate to the frontal sinuses and the maxillary sinuses. No tenderness noted. We'll move on to inspecting the mouth. Okay. We'll begin by asking the patient to assessing for cranial nerve 9 and 10, the glossopharyngeal and vagus nerve. Asking the patient to say ah. Okay. The uvula and soft palate rise with phonation. Then we'll assess cranial nerve 12, asking the patient to stick out the tongue. Okay, the tongue is midline intact without fasciculation. So we're going to inspect the mouth as a whole. The teeth are intact. The gums are pink, moist, and intact. The salivary glands are intact. The buccal mucosa is intact. The tongue is pink, moist, intact. Raise your tongue for me. The foundation of the tongue is pink, moist, and intact. The posterior phoenix is pink, moist, and intact. The tonsils are present in grade 2. The buccal mucosa is pink, moist, and intact. The salivary glands are intact. Okay. Next, we'll go down to the neck, and we're going to assess for the trachea that is midline. We're going to ask the patient to swallow, assess for the thyroid gland. Okay. Then we'll palpate for the carotid artery on each side. We're going to take our stethoscope with the bell and auscultate for any bruise. Okay, no bruise noted. Then we'll begin by inspecting the anterior and posterior chest. So we're inspecting for any signs of deformity. No deformity. Both sides are symmetrical. We're looking for any signs of respiratory distress. There's no nasal flaring, no retraction, no cyanosis, no accessory muscle use. So then we'll begin by, if you'll turn around for me, with your back to the camera. Okay. So we'll begin with the posterior chest wall. We're going to assess for chest expansion at the 10th intercostal space. I'm going to pull your shirt down, okay? So we'll ask the patient to take a deep breath. Okay? We're going to assess for tactile firmness. If you'll just say 99 every time I move my hands, okay? Okay? So then we'll percuss the lung fields at the intercostal spaces starting close to the clavicular line. Okay? So then we'll listen with the stethoscope. Breathe in and out for me. Want to be sure to get the right anterior lobe. Okay? So then we're going to auscultate for bronchotomy. You'll say the word 99 when I move the stethoscope.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay? We're assessed for egophony. You're going to elongate the letter E for me.
E, 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 E.
Okay, then we're assessed for whisper pectoralicoid. You'll whisper the number 99, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay? Then we'll go to the anterior chest. We've already done our inspection, so we're going to test for chest expansion. Take a deep breath for me. Then we'll assess for tactile fremitus. 99.
99, 99, 99.
Okay? Then we'll listen to the long sounds on the interior surface. Just take deep breaths for me. Okay? So then we're going to listen to the heart sounds using the bell and the diaphragm. So we'll start at the aortic, which is on the right side, at the second intercostal space. The pulmonic on the left side at the second intercostal space. Erb's point on the left side at the third intercostal space. This is where you will hear S1 and S2. Tricuspid at the fourth intercostal space at the sternum border. And mitral, which is at the fifth intercostal space at the mid-clavicular line. This is where you will palpate PMI and the apical pulse, which is 72 at regular rhythm. Okay. So then we'll listen on the bell side. We listen on the diaphragm. So now we'll listen to the bell for any bruits. Same sequence at the aortic, pulmonic, Erb's point, tricuspid, mitral. Okay? Then you'll ask the patient to lie down. Okay. At a 35, we will be at a 30 to 45 degree angle. We'll test for JVD, jugular vein distension on both sides. Palpate for any thrills, none noted. We'll assess the chest for any heaves or lifts, none noted. Then we want to palpate for thrills at the, I'm trying to get the vision. We'll palpate for thrills at the auscultation points. So we'll palpate at the aortic, the pulmonic, the Erb's point, tricuspid, and mitral. No thrills noted. So then we'll listen again while the patient is lying down. We'll listen with the diaphragm as well as the bell, beginning with the diaphragm at the aortic, pulmonic, Earth point, tricuspid, and mitral. We'll go with the bell at the aortic, pulmonic, Earth point, tricuspid, and mitral. Okay? Then we'll assess the abdomen for contour and symmetry. The abdomen is symmetrical and rounded. We want to listen at the arteries. We listen for any bruits. So we're going to start at the aorta, the renal, the iliac, and the femoral. Okay. Then we're going to listen for the abdominal sounds in all quadrants. Okay. Abdominal sounds are normal, active, and audible. So then we're going to palpate for any tenderness or masses. Okay, then we're percuss over each quadrant. When the fields are tympany, meaning they're over air fluid positions. Dullness would mean that they're over solid organs, and flatness would mean that they're over muscle. Okay. Respected, palpating, percuss. Okay. So then we're going to, on the left side, so we'll go ahead and inspect, palpate for the liver. It's non-palpable. We'll come over to the right and palpate for the spleen. It's non-palpable, so then we'll ask the patient to sit up. We're going to palpate for CVA tenderness. So let me know if you feel any pain. Any pain felt?
No.
Okay. So then we'll go to, just turn kind of slanted so they can see both of us. So then we'll do our DTRs on both sides. So we'll start at the brachioradialis. Okay, then we'll do the brachial, the tricep. Okay, we'll go to the other side, do the brachioradialis, the brachial, the tricep. We'll do the patellar on both sides. Okay, and then we'll do the Achilles as well. Hold your feet up for me. We'll do this one. Okay, then we'll, using the flat side, we'll assess for the Babinski reflex, okay? The Babinski tendon reflex, okay? Okay. So So now we'll begin by inspecting the upper extremity joints, starting with the shoulders, moving down. No redness, no warmth, no swelling, no nodules noted. Joints seem to be symmetrical. We're going to assess for capillary refill on both hands, less than 3 seconds. We're going to assess for the radial pulse, strong and regular. We're going to assess for hand strength. Grab my hands for me. Hand strength is strong, okay? So then we'll begin with flexion of the hands, of the fingers. So you're going to start with flexion, extension, hyperextension, abduction, thumb opposition. Okay, we'll go up to the wrist. We want to flex, extend, hyperextend, ulnar deviation, radial deviation, rotation. We'll go to our elbows. So we're going to flex. While we're flexing, we're going to go ahead and test for tricep strength, push against resistance, okay? Extend. We'll go ahead and assess for bicep strength, push against resistance, and hyperextend. Okay? We'll go up to the shoulders. We're going to assess for cranial nerve 11, which is the accessory nerve. Shrug your shoulders against resistance for me. Okay? So then we're going to flex, extend, hyperextend. Okay, hyperextend. Abduct. Internal rotation. Just like, internal rotation. Then you'll pull up against resistance. You got to pull up on against resistance, testing the strength. And then external rotation. And then against resistance, you're testing for strength. Okay? So that's the range of motion. Okay, then we're going to assess for stereognosis. So you'll hold your hands out and close your eyes for me. Okay, I'll put an object in your hand. You just tell me what it is.
A pin top.
Okay. Keep your eyes closed.
A pin.
Okay. So now we'll assess for graphesthesia. I'm going to draw an object in your hand, a letter or a number. You just tell me what it is.
0.
Okay.
A check mark.
Okay. Okay. We'll assess for strength. Okay. Now I'm just going to inspect your so we'll do the cerebral coordination. So we'll do with rapid movement. So we'll do finger to finger. You just touch my finger when I move, okay? Other hand. Okay? So then we'll do serial opposition, touching each finger to the thumb, fast as you can. Okay, then we'll do flip flop. Okay? Then we're gonna test vibration over the medial, over your wrist, over the orbital prominence.
Yes.
Okay. So then we'll inspect your lower extremities for the hips, the knees, the ankles, and the toes. There's no redness, no swelling, no nodules, everything's symmetrical. We're gonna test the capillary refill of the toes. Capillary refill is less than 3 seconds. We're going to assess the dorsal pedal pulse. Let's see something closer here. Okay. And then we'll assess the tibial pulse on both sides. Both pulses are strong and present. So then we'll start with the range of motion for our toes. So we're going to flex them. Down, extend, hyperextend. Then we're going to abduct, spread your toes. Adduct, put them together. You'll do the same with the other feet. Flex the toes, extend, hyperextend. Abduct, you'll spread them. Adduct, bring them together. Okay? So then you're doing them at the same time. You're gonna do your ankles. You're gonna plantar flex them, okay? And then try to pull up against resistance, testing the strength, okay? Then you'll dorsiflex them, try to push down against resistance, okay? Then you're gonna do inversion, turn them in, eversion, turn them out, and then rotate them. Rotate them, okay? All right. So then we're gonna test the light sensation of the upper and lower extremity. So close your eyes and just let me know when you feel the touch, okay?
I feel it, 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 feel it.
Okay. Now we'll stand up. So we'll begin with our head. We're gonna do our cervical spine. We're going to flex, extend. Cervical spine is your neck. You're gonna flex, extend, hyperextend, lateral flexion, then rotation. Okay, so then we'll go to our lumbar spine. You're gonna flex, bend, and I'm gonna check the back for any curvature or scoliosis, none noted. Then you're gonna extend, hyperextend, okay? Internal rotation, external rotation. Okay, so then we'll do the hip. So the hip, we're going to flex, extend, hyperextend, okay? With your feet, you're going to, so with your feet, you're going to turn them in. This helps with your hip. It's internal rotation, external rotation, okay? Adduct, AB duct, and circumduction. Okay, do the same with the other one. You're gonna do inversion, internal rotation, external rotation, AB duct, AD duct, circumduction. Okay, so then with your knee, and then you'll push against resistance for me. Okay, with the other side, push against resistance for me. Okay, so then you will do your knee. You're going to flex, extend, hyperextend. Okay, now you'll flex against resistance for me. Okay, the other knee will flex against resistance, hold it up. Okay, extend, hyperextend. Okay, and so now we'll assess, we'll do the Romberg assessment. You're gonna stand in place, close your eyes, put your arms out. Okay, no swing noted. So then you'll you can put them down, open your eyes. So we'll assess your gait. So you'll take a couple of steps, starting at this back wall. We'll just take a couple of steps forward. Gait is steady. Then you'll turn around and walk back, and you'll assess your tandem. So you're doing toe to heel, toe to heel, toe to heel. Okay. All right. Good. So now you'll come forward and hop on one foot for me. Okay, and this concludes my head to toe assessment.